I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of the IDD Health Matters podcast. I have a fantastic guest. I can't wait for you to meet her today, Christine Klaus. Welcome, Christine.
Thank you.
So, Christine, we're at the Home and Community-Based Services Conference, HCBS 25, and you and I were chatting yesterday, and so many things you talked about just resonated with me, and I think it'll resonate with the audience. So, at first, tell us about yourself. Tell us about the work you do.
I first and foremost am a family member. I have a 37-year-old son who's developmentally disabled. He's one of the best people I know, totally amazing. He has a high level of need. So I've been a professional parent in that league for about 37 years now. I also, through him and my experience with him, work for a nonprofit in New Jersey where we support adults with developmental disabilities over the age of 21 who receive waiver dollars so that they could participate in their community and have a meaningful life. We're very, very, I guess you could say, dedicated towards people having inclusion in the community, the company I work for.
That's great.
Yeah, so I do a navigator role, so I help a lot of people. I've been there, must say, for about 14 years now, and I'm in a role where I help our support coordination team with people who are in crisis, want housing, future planning, and a lot of that I think my company recognizes because I am a person with lived experience, I can bring a lot to the table. And I also am the coordinator of mentors and self-advocacy, so I have a mentor team under me of people with lived experience who we utilize to mentor other folks that we support at the company. My company's Neighbors, Inc. But most of all, I'm a mom.
You're a mom, yeah. And we talk a lot about health on health for people with intellectual and developmental disabilities, and I'm sure you have some stories related to health, or maybe even some challenges that you've experienced that other people could probably relate to. Would you share some of your insights on that?
Yeah, my son, like I said before, is, I guess some people might use the term profoundly brain injured since birth. He has epilepsy, and he's tube fed, and he's nonverbal. He needs 24/7 care, has since he was born. And through those 37 years, we have been through a lot of medical procedures. And one of the things that was, he was born in 1988, and so and I was very young. So I relied a lot on the professional field, thinking that they know best. And sadly, I found out over time they don't. And it's not to be disrespectful to the medical field. Sure. That's how I found you, because I was getting very worried about his future. Sure. And kind of concerned about the experiences I kept going through. So one of the I get many stories. I was thinking about them last night. And I also forgot to mention when you and I were talking the other day, my brother-in-law, God rest his soul, he also had a developmental disability. And the health care, he had passed away from pancreatic cancer. The health care he got at the end was so atrocious. The stories I should have told you yesterday, even for my son. Which one of the things we were discussing was knowing that you're, like, as a family member who cares about them, you're an integral part of that medical team. And
you know your son or your loved one. You know them, and you can identify and recognize maybe small signs that something is different that others may not see.
Right.
But communicating that to a clinician can be challenging sometimes.
Very challenging. It just made me think of the good story.
Yeah.
In 2018, my son came down with the flu, and within 24 hours, he was on life support in ICU. And when one thing we thought was very interesting, and I hope this isn't too controversial, but when they moved him from the ER to the floor, I had gone to get my husband and I dinner. We just thought they were going to give him medication, wait till he got better, send him home. And then my husband, I came back and he said, some gentleman came in here and said, gave me, we could either send him to ICU, that's probably where he's going to go, or we could leave him here and just let it go. And I remember thinking, oh my God, that's an option? So I went and found the nurse to go get that person to come back in the room, and he had explained to me where my son was heading with the illness and that I had that choice. And I remember thinking, that should never be a choice. That shouldn't even be a forethought. First, do no harm. Let's get him to the ICU.
Sure.
And even when we got him to the ICU, one of the things I started to see, and no disrespect to the medical field, I don't want that to ever come across, but I could see they were treating my son like he was just like a vegetable, if that may be the case.
Yeah, no, I understand. Yeah.
And I remember thinking, that's not going to help him, and you need to take care of him and understand him for who he is. And so I started breaking out my phone and showing
That's what I was going to say. I was like,
videos.
I can't wait for you to tell everybody what you did and how it changed things for your son.
It really did. My son uses a gait trainer out in the community every day. He walks about a mile every day. And when we were in there, it was in the wee hours of the morning, I pulled one of the nurses and the doctors aside, and I'm like, listen, can you just please take a look at this? This is who you're fighting for. This child knows what's going on. I know he's an adult. He's always my child. I said, but he's not what you think he is, and we need to get him back here. And the very, very, I guess you could say, cool thing that happened was one of the nurses came back to me and she's like, so everybody wants to see the video.
So what was on the video?
It was my son, and he was walking at Home Depot because he loves Home Depot. Sorry for the
Hey, I do too. So.
And he was just having a blast, and they could see he was like running with his walker. They could see how happy he was and how responsive, like he was to his world and the people that were saying hello to him. And that's where they were, but it was just so neat how, because they were coming in, other nurses were coming in to see the video. And one of the nurses came in the next night, she said, that was the best thing you ever did. We actually got to see who we were taking care of.
Yep.
And I was like, yeah, and let's get there. And it was amazing how it changed everybody. But as a parent, I did it because I was observing something, but at the same time, I'm kind of like, should I do this? Should I not do this? But I just went for it because I could see my kid's life on that.
Well, there's no doubt it was the right thing to do. And, there are so many assumptions that we all make. We all make assumptions about things all the time. But I think there's a big assumption that is made about people with intellectual and developmental disabilities is, well, their quality of life is not good. Just blanket across the across the table. It's like, oh, they don't have a good quality of life. I've experienced that when advocating for health care for some of the people that I was supporting that moved to a different hospital because they had become ill. It's like, oh, well, they just don't have a good quality of life. I said, let me tell you who this person is.
Yes.
And when they're not suffering from the flu or pneumonia or whatever it might be, they do have a quality of life. And a different quality of life does not equal a lower quality of life. It's just different.
Yes.
And, you helping them see your son as a person first
Yes.
is what made the difference in his care, it sounds like.
Huge difference.
Yeah.
And it's interesting because even I was just thinking, as you just said that, every doctor I go to, when we tell them, because they automatically assume that. And when I tell them he walks a mile, as a matter of fact, in the last report I have a functional medicine doctor I just love, and in that report she even she loved the fact that he walks
a mile a day. I unfortunately don't do that.
That's what she said. So that's what it was like. But it's just interesting to see the different approach. However, listening to you today, I'm like, I'd never thought about it from that perspective, and yeah, that needs to change.
Yeah, it does need to change, and that's one of the things that I advocate for education of all clinicians and really everyone who works in this field about understanding people with IDD better, recognizing that they are people first, that they're not a diagnosis first,
Right.
Understanding that quality of life is different, and then learning and understanding how to recognize the different ways illnesses might present in people with IDD.
Yeah.
That can be challenging.
Yeah.
Sometimes it's a slight change in behavior, and your son, and okay, this is something's going on here, but others may not recognize that as a sign of an early sign of a treatable condition. And to me, that all boils down to education and training. And I've used this story before. I'm a family physician. If you came to see me to have cataract removed, it wouldn't go well because I'm not trained to do that. It's not
Right.
that I don't care. It's not that I don't want to do the right thing. I just wouldn't know what to do.
Right.
So it all boils down to training, and I'm a huge advocate for increasing medical school, nursing school, all allied health professional schools, increasing the amount of training to clinicians about how to provide good health care for people with intellectual and developmental disabilities.
Yeah.
Yeah, it's
That's
so important.
very important. As a matter of
Yeah.
fact, that's last year when I went to your booth. You weren't there, it was other people, but that's ever since then I've kept in touch because I really want this to come to New Jersey, this kind of training, this kind of mindset. I've even talked to my son's medical team. I'm like, I really want you to check this out or even be part of it, because it's nothing, again, it's a tricky place for me to be because also at the same time, you don't want to be disrespectful to your medical team, like you don't know anything. That's not what I mean.
Yeah,
So
I appreciate that perspective very much because having been in a position of really not knowing what to do myself early on in my career, I didn't know what to do. I wasn't trained, and the first person I remember seeing with a disability was he was an adult. He was in his 20s with cerebral palsy. He did not use words to communicate, and he came in with his mother. And I was like, okay, I'm not sure exactly what I need to do. And so I was talking to his mom, and his mom was so gentle and so kind, and unfortunately had probably experienced this too many times, but helped guide me and tell me, well, he's not acting the way that he usually does, and often that could mean that he's very constipated, which is a big problem, but sometimes he has an ear infection, and I know that he's not constipated because that's been going okay, but could you just look in his ear? And I was like, okay. And I mean, she gently guided me, and that was so humbling and very impactful. And that shouldn't be the case. Any person with any level of disability or no disability should be able to present to a doctor's office or a hospital setting and receive a basic level of competent and compassionate health care. And to me, that starts with training.
Absolutely.
And education.
Education.
Yeah.
Because the fact that education wasn't there from the beginning is why you're here today.
That is exactly why I'm here today.
Yeah.
And those early experiences I had shaped so much of what I do now.
Yeah. And I'm grateful for that.
Well,
that's why I
thank you.
highly
So
recommend it.
you mentioned some of the things that you'd like to bring to New Jersey, and you saw them at our booth. What were some of the things in particular that have impacted you or have been helpful to you?
Well, I personally bought some of the trainings already. The Fatal 5 was one of the best trainings because they're the simplest little things that get overlooked. And the thing is, it reminds me of reflux, right? The GERD. When you have somebody who's nonverbal, you have no clue.
Right.
You have no clue what's going on until... I'll give you an example with my son. He was on an antibiotic for several months, and towards the last 6 weeks of being on an antibiotic, he kept gagging and retching and gagging, and they were like, oh, it's just the nausea from that. But there were times he'd really spit up, and I was just like, that acid in his esophagus cannot be a good thing over and over and over again. And I kept pushing for labs to be done, and I kept watching his hemoglobin drop. And then finally I asked his functional medicine doctor, I'm like, can we please look at this? She did extensive studies, and he's anemic.
Yeah.
And one of the things for men aren't usually anemic, but it's a slow intestinal bleed. And, my daughter had always complained. She's like, Mom, his breath smells odd. And, and this was like
another
indicator.
sign. Yep.
Yeah. And so it wasn't for that training that I was kind of like, that's got to be it. And we got him on medication. It was just really interesting because since we got him on medication, he's not gagging as much as he used to. And he's much more comfortable. So it was just like something simple like that. But even with the Fatal 5, it's that GERD that also can cause the aspiration. So I was just like, oh my God. So not only is the Fatal 5 great for clinicians, but it's also good for families to take a look at. And it really isn't something that's going to eat your time up. And it was very well taught. It was something anybody can understand. And I think that's really important. Because you sometimes have maybe a grandma taking care of somebody. I've seen it. The company I work for, we support close to 1,700 people across the state of New Jersey, various ages between 21 and probably like 80. And so a lot of times, even when I go out to work with some of the families, I'm taking a look at that person and I'm wondering, are they doing that because of it? And I have to just say, the one training I did love was the one that you did on, you gave case examples, which I thought was really important. And one of the case examples was about that woman who was actually being abused by her father.
Yes.
And everybody was treating her for her behaviors.
Right.
Instead of looking at, when she came back from being there for the weekend, what's going on? Nobody thinks about this population. It's always that what you just said before, they focus on the diagnosis and not the person.
Yeah, and what's wrong with them?
Yes.
Not what could be happening to them in the situation of abuse.
Absolutely.
And we know that abuse, physical, sexual abuse has a much higher incidence in people with intellectual and developmental disabilities.
Way higher.
Yeah, so it needs to be in our thought process. I love how you stated earlier how the training helped you in a way where you were, I think you said you were working with someone and you saw this person and you're like, I wonder if they could be having reflux because of the training. And that's the goal of the training, is to help people think about these things that are actually fairly common.
Yes.
And not only is it dangerous, but it's uncomfortable. It's painful. Who would want to live with acid reflux every day of their lives if it can be treated?
Absolutely.
So it's not just about, let's, stop the behavior or whatever. Let's make the person have less pain, maybe.
Absolutely.
A lot less
Quality
suffering,
of life,
and
just
enjoy. Exactly. So
Yeah.
I appreciate that perspective.
Yeah.
So in the work that you do, you mentioned families and other. I mean, I guess you work with family members, but also professionals and all of that. Are there particular components of some of the training that you've seen that you think, you mentioned Fatal 5, but and which, by the way, Fatal 5 are the top preventable causes of illness and death in people with IDD, and we actually call it the Fatal 5 Plus now because we have 6.
Oh.
So but it's aspiration, dehydration, constipation and bowel obstruction, sepsis, seizures, and then gastroesophageal reflux, which you mentioned. No, it's in there. But and I think let's talk about seizures actually instead of the question I was going to ask you. You mentioned your son has
epilepsy,
seizures. He has epilepsy. And we talked some about medications and some of the challenges yesterday. Would you elaborate a little bit on that?
Sure. And if you don't mind me, I just was wondering, because there's a couple components there.
Yeah.
My son is on the ketogenic diet.
Yeah.
as well as some anti-epileptics. And we're trying to wean my son off that one of the medications because he's been on it for a very long time, and it can cause long-term liver damage,
long-term side effects.
Yeah, yeah. And when we wean him off the one drug, one of the other drugs is going to need to be increased because the one drug actually kind of ramps up that medication. So when we were at the neurologist's office and I was talking to him about it, I had asked if we would do levels, and at first he was kind of like, I don't see a need to, we'll do them in a couple months. And I was like, but then how will we know where that one particular drug, can we at least test, for example, it's the lamotrigine. And I'm like, can we at least test for lamotrigine to see exactly where the levels are? Because if they're way too low, maybe we need to raise the dose up a little bit higher to give him that little bit of cushion. And he's like, that's a good idea. I remember thinking, and I got to say, I adore him. We've been his patient. My son has been his patient for a very long time. And what I do love about him is that he works with me. But still, that scares me sometimes because I'm like, you're supposed to be the leader here, not me. But he's very open-minded. He will explore various different techniques or I can't even think of the word, I apologize, but treatment plans.
Treatment plans,
yeah.
sure.
But when he said that, it was like, that's a good idea. I thought to myself, I wonder what would happen if I had not said anything. And I'm just speaking from a parental view, and that's why I was thinking after 37 years, you'd think I would have enough confidence to know that I am part of that medical team. But that's something that's not taught to families either. So we need to work on that.
It's not taught to families, and it's not always received in the best way sometimes from clinicians. I hate to say that. I'm one of them. But sometimes clinicians, a supporter might come in and say, doc, he's having these behaviors, and that might mean he could have this. And the doctor might say, okay, fine, whatever. I'll figure it out.
Yeah.
And not really take into account the tremendously valuable insights from people who may not be a nurse or a doctor or whatever, but they know that person. And that is so key to recognizing health conditions, and is knowing that person and how they express things such as pain, if they're uncomfortable, what do they like, what do they dislike, and supporters know that. So they may not be able to tell you sometimes, hey, this is the medical problem that's happening. But what they may say is, something's going on that is not right. There is some change, and this is not my son or my daughter or the person that I work with, and something's different, and we need to figure out what's going on.
Absolutely.
And I've heard that story so many times, and then unfortunately I've also heard the story that then the clinician comes back and says, well, this is just what they do because they have a disability. Sometimes people hit their heads, because they have a disability, or they slap their arms, or whatever it is. And that's usually there's a reason for it underlying.
Oh, yes.
A treatable underlying reason.
Yes.
And that's the type of training and education that all clinicians need to have. They need to understand those connections, and family members, I think, can benefit from that same understanding to understand those things as well too.
Yes, because a lot of times I've seen through the work I've done with families is that because you are the professional, they're not even thinking about what they know and what they have to offer. It's your right. Even though no disrespect again, you might not be right.
Right.
And they might be sitting there banging their head against the wall. So,
the fact that you have a healthcare professional that works with you is fantastic. It does take, in many instances, multiple perspectives or a multidisciplinary approach to provide support and provide good health care to different groups of people. And because, as you said earlier, when a healthcare provider, when a person with a disability doesn't use words to communicate, it's really hard for them to tell you, oh, my chest hurts, oh, I'm having a burning in my throat. You don't really know unless you observe. And then sometimes those behaviors from the medical condition, the way the person acts or responds to those, can sometimes be aggressive or difficult. They can be dangerous, and so the person ends up going to the psychiatrist and getting put on a medication to stop the behavior.
Yes.
And the whole time there was something like reflux or a dental abscess is another.
Yeah. Oh, the stories I have even in the professional field. It was just, we had one gentleman who was living in a group home, and boy, oh boy, was he was a headbanger. Very interesting.
Yeah.
And one of them had observed that he had increased in that behavior. And the next thing we knew, we got a call saying, we have a problem here because he's pulling his teeth out. And it was because of an abscess.
Yeah.
But it took
It wasn't because that's just what people with IDD do.
I remember thinking he had to pull his teeth out. Oh, my goodness. And that's where I'm here today. That's why I want to get your training in. I have to also include that when I bought the Fatal Five, I bought it so we could also train my son's staff. I'm trying to build Team Travis so people can, my husband and I can just be parents sometimes.
Yeah.
And
you need that relief sometimes to just be parents and not have to do it all, right?
All the time. But the other thing is, I have to be honest, and my son is very clear about this, is that he needs a break from us. Yeah.
And that's pretty normal too. So.
But again, I'm trying to build this team of people, and one of the things I want to put in place, because my son can't communicate like everyone else, and he does have complex needs, I want my son's staff, to hear what you have to say, to understand these trainings, we're starting with the Fatal Five, so that when they look at him, they might be like, this is what they might have been talking about. Oh, hey, let's just give the primary a call. I also want the primaries to do the training too, because they may not have seen it themselves.
Right. When they get the call, you want them to be able to make those connections and understand it and provide it a good assessment and treatment plan as well.
Absolutely. Yeah. Even I met the gentleman that you introduced me to yesterday, and I was looking at that website, and one of the things they'll do, which I want to meet with him again and say, can you explain a little bit about it? But they do this telemed for folks with IDD, and one of the things they'll do is, if they see it as you have to go to the ER, they're calling that ER ahead of time. Well, wish I had that on so many occasions, because when you get there, it's really a mess. That's all I got to say. It's scary.
So for the audience, it's Station MD, who we partner with. Actually, we actually train their clinicians.
Oh, wow.
And we also have another interoperable component to our health risk screening tool with their EHR, electronic health record platform, because that connection is so important, and you just described a great example. If they're seeing a person with a disability and they think they do need to go to the ER, they're going to call and tell them, hey, here's what's going on, here's an approach to take. It's kind of a warm handoff to the next level of care, which is very, very good and very valuable.
Very valuable. Truly, I know the need. I've been there, done that, and those are just some of the stories I have as a personal, and like I said, I've seen enough.
I'm Dr. Craig Escudé, President of IntellectAbility. State developmental disability agencies, managed care organizations, and providers across the United States use IntellectAbility's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. Well, Christine, One of the things that I ask every guest is to tell us 3 things that they think can improve the world for people with IDD. It can be health and wellness related or something else, but just 3 words of wisdom that you'd like to share with the audience.
Yeah, I apologize. I had written them down, so I don't want to forget them.
There's no apology necessary there.
Let's get back to my notes here. So for family members, don't be afraid to speak up. You know more than you think you know. And you are part of that team.
Yes.
And I think the minute you feel uncomfortable, that's a message. Get somebody else. Or speak up even stronger. Give them examples like I did with my son. Show them the person they are. So that would be my first one.
That's hugely important.
Very.
Yeah.
The second thing was, I even asked him, is this okay to do? Because I don't want to sound like an infomercial. But please, anybody, clinicians, anybody, please take a look at IntellectAbility. The training's amazing. It's so necessary. Please is all I can say. I've been through the field. I know you all care. That's why you came into this field. But it's lacking. So please take a look at everything IntellectAbility offers, which is another thing for family members, caregivers, support staff. If you can, go on the website. There's a really good book, Pearls of Wisdom.
Clinical Pearls in IDD Healthcare.
Help me out. Sorry.
No worries. Thank you, though. But yeah, Clinical Pearls in IDD Healthcare.
Yeah, and it's worth it. It will help you in so many ways, and the person. And I just realized, even yourself, if you experience a developmental disability, because there are plenty of people who can advocate for themselves, get the book. And if you have a hard time reading it, somebody to read it to you. It'll empower you even more. And then the third thing is, this is nothing like we really talked about, but one of the things I learned through all the medical experiences I've had with my son, your nurse is your best friend. When you end up in the hospital, they're just amazing. They operate at a different wavelength, because they kind of actually are a little bit more personalized. Is nothing to be disrespectful.
Right. No, you're right.
They're more personalized. And I found that if you understand where they're coming from, because I know the nurses know this too, but especially I think of all the times I've been in the hospital for countless days, sometimes weeks. I'm tired, I'm hungry, I'm cranky, I may not be myself, but they've always managed to also recognize that. At least I've been so blessed, where they would always get me to the coffee room or just bring me the extra blankets. But we worked as a team, so your nurse is your best friend. If they don't show up, it's not because they're just, don't feel like doing their job for the most part. That's how you might feel that day. But just they are your lifeline. They'll also be the person who will get the message to the doctor in a little bit of a different way. So those would be my 3 things for today.
Those are wonderful. Christine, thank you so much for
you're
talking
welcome.
with me today and sharing your thoughts and insights. I know everyone listening will find them very valuable. And
I hope so.
I'd love to talk with you again sometime, if that's okay.
Oh, absolutely. And again, thank you for doing what you do, for being, I want to say, brave enough, for putting something together and telling your fellow clinicians there's some improvement that needs to happen here. They are people too. We're all people. And one thing I just want to say, quality of life. Even though you might think they don't have a good quality of life, you helping them feel better makes that low quality of life even better.
It does.
Yeah. They deserve it. So thank you.
For saying that.
Yeah.
The IDD Health Matters podcast is a production of IntellectAbility. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.